or rural areas had little more than 8 posts built from bush materials. Diseases like Big Bell, Kuru, and yours were causing death and disability, and these have now been eradicated or controlled. Maternal and infant mortality rates were high, and life expectancy was just 55 years. Today, it's 66 years. In those early years, we delivered basic services with limited infrastructure, resources, and skills. Over the past 5 decades, Papua New Guinea has journeyed from a fragmented and fragile health system at independence to one that is modernizing, expanding, and increasingly capable of delivering advanced specialist services once thought impossible. Mr. Speaker, in 1990, 470 mothers died from every 100,000 births. Today, that number has fallen to 171. In 2011, there were 153 midwives in the whole country. Today, there are more than 1,000 midwives, ensuring that the next generation of Papua New Guineans are delivered safely into this world. Child survival has improved. Under 5 mortality has dropped from 95 per 1,000 in 1990 to 44 today. Immunization has saved countless lives. Last year, 72% of children were vaccinated against measles, rubella, and there is currently an active campaign to vaccinate up to 95% of children against polio. And today, Papua New Guinean specialists are performing advanced surgeries once thought impossible. Kidney transplants, heart surgery, and angioplasty are performed by our specialists. Mr. Speaker, we have also strengthened the health system itself. We established the provincial health authorities, bringing leadership and services closer to our people. We introduced 2 editions of the National Health Service Standards, setting out the services required at every level of facility and defining the standards of safe, quality care and required staffing numbers. In 2020, we adopted the 7th National Health Plan 2021 to 2030, a roadmap to strengthen primary health care, infrastructure, workforce and supply chains. And throughout this journey, church-run health services have been critical to our sector. They provide almost half of all our rural health care. They train most of our health workers, and they continue to serve our people faithfully in the remotest corners of our nation. Mr. Speaker, we thank them today for the ongoing support to our health system. In terms of education and research milestones, Mr. Speaker, we must also celebrate the institutions that have shaped our health journey. The Papua New Guinea Institute of Medical Research is a source of national pride. Since 1968, it has expanded into 14 provinces and delivered life-saving research, and is an established, credible research institute, attracting researchers from across the globe. The UPNG School of Medicine and Health Sciences, born out of the Papuan Medical College, has trained generations of doctors, nurses, pharmacists, and dentists who now staff our hospitals and PHAs. The school is itself transforming into a standalone PNG University of Medical and Health Sciences, a bold step to addressing specialist workforce shortages, ensure accreditation and raise the quality of training. I thank the members of Parliament for supporting the PNG Medicine and Health Sciences Act of 2025, which sets the legal foundation for this university. The ambition is for 200 medical enrollments annually starting from 2027, and with a foundation science course to improve quality and quantity of applicants to the medical program. I thank the Minister of Higher Education in his leadership to progress the establishment of this university. Mr. Speaker, the Bougainville University commenced the Bachelors of Medicine and Bachelors of Surgery in 2017. In 2021, 14 doctors graduated from the pioneer class, with 4 more batches of graduates, adding a total of 89 to our cadre of doctors. All these doctors have been absorbed into the workforce. This is alongside the Bougainville University's other specialist health training programs, including nursing, health extension officer training, health management, environmental health, physiotherapy, and eye care. Mr. Speaker, I also acknowledge the Bougainville University postgraduate master's program that have also equipped many of our health leaders. Our network of health worker training schools for nurses and community health workers have expanded to 38 schools and colleges located across provinces. Of these, 22 are managed by our church partners. Collectively, they produce up to or more than 1,500 graduates every year who are trained specifically to serve our population. Mr. Speaker, but we have challenges. We face challenges that impact our health system and constrain our ability to deliver. The population growth of 2.7% annually is creating a demand for services that outstrips our current availability of budget and services. The double burden of non-communicable diseases alongside the continued spread of communicable diseases like tuberculosis, malaria, HIV/AIDS, along with an unmet need for mental health services, places numerous enormous pressure to our limited health resources. Non-communicable diseases are more difficult and more expensive to treat. We are seeing a concerning increase in lifestyle diseases like diabetes, cancer, cardiovascular diseases, which are driven by poor diet, smoking and alcohol, and inactivity. The COVID-19 pandemic revealed weaknesses in our health, in our ability to respond quickly and efficiently to health emergencies. Earthquake, volcanic eruptions, and landslide, tribal conflicts, and disease outbreaks have required unplanned surges in our resources not budgeted for. Last year, PNG experienced a re-emergence of polio, which is a result of long-standing problem of low vaccination rates among our children. But with substantial support from our partners, Mr. Speaker, I am pleased to inform this Parliament that we are on track to being declared polio-free once again. Mobilizing adequate resources to meet the ongoing health needs of our country is the core of our challenges. Mr. Speaker, but we have reset our way forward for the health system. The Medium-Term Development Plan 4 and the National Health Plan 2021 to 2030 are the roadmaps for transforming our health system. 80% of the population health problems can be managed at our rural facilities. Therefore, at the heart of our health plan is a focus on expanding rural healthcare, which is the most cost-effective way to improve health. Simultaneously, we are building a district and provincial services at a phase consistent with budget and human resource availability. So the full spectrum of prevention, treatment and care is available to our people. We are targeting investment on expanding health infrastructure, improving medical supply chains, strengthening public health program, and ensuring that there is enough trained health workers. Mr. Speaker, in terms of human resource, health workforce is a cornerstone of our healthcare system. Healthcare cannot be delivered without people, yet skilled workforce shortages remain our greatest constraint. Today we have one healthcare worker for every 1,000 people. This is well below the World Health Organization standard of a minimum of 4 health workers for every 1,000 people. Whilst 87% of our population live in rural areas, only 34% of our workforce serves there. This imbalance continues to deny rural communities fair and equitable access to care. Of the 32,064 established positions in the health sector, 11,135 remain unfilled, highlighting the urgent need for stronger recruitment, deployment, training and retention strategies. Mr. Speaker, the Maraperoso government has demonstrated its commitment to addressing workforce shortages by approving an increase of 233.2 million kina for personal emoluments in 2025. I am pleased to report that the recruitment of 7,000 of these vacancies of healthcare workers, particularly for rural and underserved areas, is still underway. In 2026, 1.5 billion kina was allocated to personal emoluments, which is a 60 million kina increase from 2025. Whilst this recruitment is positive, we still need to substantially increase the number of health workers. A 2024 analysis projected by 2032, PNG will need at least 44,061 health workers to meet the growing or increased demand for primary health services for our population. Mr. Speaker, we need to invest in education, accelerate recruitment, incentivize rural work, and support continuous professional development. We must also foster a culture that values our health workers, prioritize their well-being, and ensure that they have safe working conditions. In addition to managing workforce shortages, we are actively working to align our workforce with service delivery needs, improve the recruitment and deployment of health workers. Mr. Speaker, a Health Service Commission is being established under the National Health Board to guide sector workforce strategies. Longer term, my department will establish a wing with dedicated workforce function and staff, and the Provincial Health Authority administrative regulations are being established to enact the authority to recruit and manage their own human resources. Mr. Speaker, this year we will commence the modernization of our regulatory bodies by moving to a digital registration process for our health workers. This will allow our rural workforce to register online instead of traveling to urban centers to submit forms under the paper-based system. To encourage doctors to work in rural areas or remote areas, an incentive scheme agreed by the National Doctors Association enables an 100,000 kina allowance for doctors willing to relocate to rural and remote areas. So, members of Parliament, I urge all of us to support this so we have doctors going to rural communities. Mr. Speaker, I am also pleased to report a significant achievement in the health sector that highlights our commitment to building capacity and strengthening leadership in the health management. Through a collaborative partnership between the Health Service Sector Development Program, the University of Papua New Guinea, School of Business and Public Policy, the Bougainville University, we have successfully delivered the Health Executive Leadership and Management Program. This program is specifically designed to develop next generation of health leaders who will manage and guide our provincial health authorities and national health institutions. To date, 70 participants graduated from the program last year, and further 42 participants are expected to graduate this year. Importantly, the impact of this program is already being realized across the sector. 3 graduates of this program have progressed to become CEOs of PHAs, demonstrating the value of investing in leadership development within our health system. Mr. Speaker, this training has strengthened leadership, governance and management capacity across PHAs and other health agencies. We are now seeing measurable improvements in organizational performance. In particular, there has been notable improvement in the consistency of annual reporting by PHAs compared to previous years. In addition, the quality of annual budget submissions from PHAs has significantly improved, ensuring stronger alignment with national priorities and more effective use of limited resources. This investment in leadership development is critical to building a resilient and accountable health system that can effectively deliver services to our people. Mr. Speaker, these initiatives with stronger recruitment, both local and overseas, now on new training pathways, better incentives and leadership development will help build the health workforce our people deserve. Mr. Speaker, in terms of infrastructures, we are complementing our workforce initiative with an expansion of health infrastructure. To ensure infrastructure resources are well directed, the National Health Infrastructure Plan 2021 to 2035, which is also attached to your report today, was approved by NEC last year. This plan is based on a robust assessment of what services are needed and where, so that every kina spent delivers maximum benefit to our people. The plan prioritizes underserved areas so that we address the inequities and service provision. The plan aligns with the provincial level health service plans of all 21 provinces plus Bougainville. From now on, all new or refurbished health center infrastructure must align to this plan. Facilities must be designed according to the National Health Service standards, and planning for the human resource requirements must be included from the outset. Please consult the department when you are planning to do something for health. Under the plan, we are implementing programs of work targeting the 6 different levels of health facilities. For our level 6 facility, the redevelopment of Fort Hospital into National Teaching and Referral Specialist Hospital has commenced. A master plan has been developed, and already we have witnessed major advances eliminating the need for many patients to travel abroad. The first 2 successful kidney transplants in PNG's history performed last year. The 1,327 cardiac catheterization treatments since July 2021, saving around 100 million kina to overseas or in overseas referrals. I thank the People's Republic of China for its long-standing partnership with PMGH since 2002 and for visiting Chinese doctors who train our doctors in advanced surgical techniques. PMGH is expanding the cancer and cardiac units, allowing more patients to be treated from the growing burden of non-communicable diseases. For example, the Cancer Center will house 2 linear accelerator cancer machines, a nuclear medicine department for PET scanning and advanced treatment options, including immunotherapy. The government has already released 160 million kina of the 300 million kina required, with 60 million kina more allocated this year. The first phase of service is expected to be commissioned in 2026, with other services spaced out to 2030. Once completed, it will be the most advanced facility of its kind in the Pacific, within the Pacific region. And this month, PNG will join a regional meeting to progress our role as the Pacific hub for strengthening radiation infrastructure under the International Atomic Energy Agency, with support from Australian partners. Mr. Speaker, I'm pleased to announce that Papua New Guinea currently is a member of IEA, a member of our International Atomic Energy Agency under the Vienna Convention on Radiation Safety. With the support from the New Zealand and Australian government and the Fred Ollos Foundation, a Center for Eye Health will be completed this year, providing specialist eye care for patients across the country with training for eye care professionals. At the same time, we are strengthening our provincial hospitals, including Laloki Psychiatric Hospital. The provincial hospital program ties together with planning and funding for level 5 provincial hospitals that is being currently considered by NEC. We have already made good progress with the development of Engau Memorial Hospital, supported by the Government of Australia, and the Goroka Hospital in Eastern Highlands and Boram Hospital in East Pacific, among the largest hospital projects since independence. A recent assessment of Engau has mapped the actions required to manage current issues and to separate the management and funding of hospital in a long term. This will ensure growth and improvements are made at the Engau and the Morobe PHA. The Engau Provincial Hospital, the first hospital that's fully funded by our government, has been commissioned and will deliver high-level services to the people of Engau. And I want to acknowledge the leadership by the Engau governor, whom I learned yesterday that all the in-person services are now being commissioned for use by our people there. Ongoing engagement with the Department of Treasury and works on 6 new provincial hospitals progressing our long-term agenda to expand access to safe, modern health facilities. However, this must be balanced with continued investment in primary health care and prudent management within our tight fiscal environment. Critically, Mr. Speaker, the National Health Infrastructure Plan 2025 to 2035 presents the priorities for building up our lower-level facilities to provide rural facilities or rural services in districts and local level governments. Over the past decade, more than 50 new facilities, including 35 community health posts and health centers, have been built across the nation, with at least 10 more in planning or under construction. These facilities meet the PNG's National Health Service standards and building codes. Many have been constructed in some of our most remotest areas like Kopiago, Amonti, Aumba, Gloucester, Malamuni and Mabudawan, delivered on time and at low cost. I thank the Government of Australia and the Asian Development Bank for funding and support for these important projects. Plans are well advanced to continue this work, ensuring we continue to transform the health services in rural and underserved areas. I also thank the Treasury Department, the leadership of the Treasurer, for negotiating the loans and making sure that this is possible. Mr. Speaker, we have established a project management unit at the department to make sure that we coordinate the funding that's going through with the support from ADB, DFED and Australian government. In the past, everyone was doing their own things. We now have a system in place. PM is now in place. We have a plan. We have established a system to have a co-M&E, and so there's one reporting. In addition, the construction of 140 million kina National Reference Laboratory will commence in 2026. This facility will provide advanced diagnostic testing for faster and more accurate identification of infectious and non-communicable diseases. It will strengthen disease management, inform public health interventions, and play a critical role in real-time surveillance of outbreaks. My fellow honourable members, a copy of the National Health Infrastructure Plan 2025 to 2035 has been provided to you today, so that you have information about what type of facility is needed in your respective LLGs and the districts to meet our people's needs, health needs. Please work alongside me and the department to support the health sector to expand health care. You are responsible for securing the land. Work lo ground ya, and work lo members of parliament on the land place. No can talk lo. Department of Health steady ground lo you. Before lo make it work lo place. Okay, helping with the staff accommodation, improving the facility. You are also needed to work with the communities to ensure that the safety blow contractors that will make it work important, and to prepare them to respect and maintain the facility once it's completed. Importantly, you can help deliver services in the districts by allocating the district grants to build 8 posts. 8 posts and plant about 40-60% of them closed. So I'm asking today in this particular statement to have DSRB funds allocated to especially 8 posts. Level 2, Level 3, Level 4, and maybe you can support into the program of the Department of Health. So I appeal to members of Parliament to support this. If we work together, prioritize funding where it's needed most, we can improve health of our citizens. Mr. Speaker, in terms of medical supply system, medicines are vital to our health system and our facilities. Demand for medicines grow every year as our population increases and health services expand. Government must therefore ensure that both the budget and the systems for procurement, storage and distribution are strong enough to meet this demand. In 2026, government has allocated 349.4 million kina for essential medicines and health commodities, including supplies for TB, HIV, and malaria, reproductive health and vaccines. Treasury has already released 106 million kina in February to allow procurement to commence early this year. We thank the Treasury for supporting us in this. Mr. Speaker, for the first time, a comprehensive medical supplies procurement plan now guides purchasing decisions. This includes moving toward multi-year tenders for high-volume medicines, improving value for money, and ensuring more reliable supply across our country. To strengthen accountability and transparency, the M-Supply inventory system has now been installed across all area medical stores and major hospitals. This enables real-time tracking of stock and reduces losses and wastage across the system. Mr. Speaker, we are also strengthening storage and warehousing. The Lay area medical store destroyed by fire in 2024 is now being rebuilt. Storage space at Badili remains under pressure. So a second warehouse at Konedebu is being built to store malaria, TB and HIV medicines, along with vaccines to relieve congestion. The Chuaka area medical store or provincial medical store has been completed. Construction of Vishnu Britain store is almost finished, and tender for Oro store will be released by June this year. Mr. Speaker, we acknowledge that the system is recovering from past storages to address the availability of 428 essential items. Tenders were awarded late last year and deliveries are now underway. We expect that 70% of these items are currently available or will be available by the end of this month. Last year, in medical supplies, up to 40 to 50% of supplies were in the system. It's now improved to 70% at the moment as I speak. With the support from UNICEF, the department is mapping and costing the entire supply chain from area medical stores to the provincial stores and onward to health facilities to determine the most logistical distribution routes. Distribution will progressively be managed by the provincial health authorities, strengthening accountability and reliability closer to where the medicines are needed. Mr. Speaker, the department is also implementing the recommendations of the Public Accounts Committee inquiry into the procurement, supply and distribution of medicines. And the recommendations have been addressed, including strengthening the medical supplies division and improving inventory and oversight systems. Mr. Speaker, recommendations to outsource aspects of the procurement and warehousing are now being finalized by the National Department of Health for NEC's consideration as part of broader reforms to strengthen efficiency, accountability and supply reliability. Taken together, these reforms are restoring confidence in the medical supply system and, more importantly, ensuring that essential medicines reach our people in every province when they are most needed. In terms of public health, immunization, together with family planning, remains one of the most cost-effective public health interventions in the world. Every kina we spend on vaccines returns 54 times the value. Immunization keeps children in school, it keeps caregivers productive, and it builds a healthy, resilient population. I acknowledge the Mara Barroso government for increasing vaccine funding in 2026 budget from 18.7 million kina in 2025 to 26.6 million kina this year. This is the first time Papua New Guinea government has fully funded the vaccine required for our children, Mr. Speaker. Mr. Speaker, every year an average of 686 women in PNG die from cervical cancer, with untold cost to families, communities and the nation. I'm proud to advise this Honourable House that this year we will embark on a historic journey to introduce HPV or human papillomavirus vaccine so that in the future Papua New Guinean women do not die from this disease. In partnership with the Department of Education, a campaign targeting 900,000 girls aged 10 to 14 will be rolled out this year. The girls will receive vaccination. This vaccination will be protected from developing cervical cancer later in life. The vaccine will then be integrated into our routine immunizations schedule and made available to every successive cohort of girls. This is a landmark public health initiative and we must do all we can to make it a success. And also I call on every honourable members when the rollout begins, fund vaccination teams to reach your remote communities and schools and encourage families in your electorates to bring their daughters forward for vaccination. Mr. Speaker, the National STI HIV Strategy 2023-2027 is already in place. Elimination strategies for TB and malaria are in place. These diseases can be controlled if we allocate the right resources to it. Mr. Speaker, non-communicable diseases, non-communicable diseases such as heart disease, diabetes and cancer are rising fast. Our response must be multi-sectoral and focused on prevention of harmful behaviors that drive these diseases. Underpinning the success of disease control and health security is a strong surveillance system. PNG has its own electronic health information system which has been rolled out to every health facility and the data collected used for decision making across the health sector. From EHNIS, a summary of key health statistics for each district has been developed, Mr. Speaker, and this is one of the documents that is now with the files that are presented to the members of Parliament today. I acknowledge the Data for Health project funded by Bloomberg Philanthropists for this important support. The new National Reference Laboratory, as mentioned, will complement our surveillance system by further advancing our capacity to identify diseases and target our interventions. Last year, we used the Tobacco Control Act of 2016 to ban e-cigarettes to stop this product from entering our country. Together with the tobacco control regulations to be finalized shortly, we are taking steps to reducing tobacco use and deadly health risks that come with it. Strengthening our legislations, my department is working to update and reform our health laws and regulations to support a resilient and responsive health system for PNG. This includes several critical legislation reviews and regulatory reforms across the health sector, including the PHA administrative and staffing regulations, the tobacco control regulations, as already mentioned, the development of a specialist hospital bill and the health practitioners bill, and amendments to the Mental Health Act of 2015. Last week, the NEC approved the public health policy. This is a significant step towards paving the way for the modernization of the Public Health Act of 1973 to better protect and promote health and ensure our laws are prepared for future health risks and emergencies. These changes will implement key health policy to prioritize and ensure our legal and regulatory framework for the health system are in place or in line with the contemporary and global practice and adapted to the specific needs of our country. Mr. Speaker, in terms of support to Bougainville, we are supporting the Bougainville Department of Health as it takes responsibility for its people. My department has worked closely with the former Minister for Health, Dennis Lokonai, and his team to begin transferring national health functions starting from Bougainville Hospital. And I look forward to working closely with the new Health Minister, Honourable Deludis Samaso, which I met last week. To formalize this, last year we signed a MOA between the two governments to facilitate the sustainable transfer of health functions in a coordinated and structured manner. As part of this transfer process, I have signed the declaration under the Public Hospitals Act of 1994 to formalize that the Buka General Hospital is the current public hospital serving the people of Bougainville. I am pleased to say that nomination for the first ever Buka Hospital Board are now under consideration, making our joint commitment to effective governance of health in ABG. In partnership with ABG and the local national member, we have agreed to build a new Level 5 provincial Hospital at Arawa, master planning has commenced, and I commend the ABG leadership for the delivery of these services to the people. And with the support from Australian government and Asian Development Bank, the Sorokan Health Center has been built and about to be opened, and the new Bougainville District Hospital is under construction. Mr. Speaker, I thank our partners for standing with us in this important work. Mr. Speaker, in terms of partnership, it is important to remember that we strive to improve the health and well-being of our population. Health is not solely the responsibility of the health sector. While health care services are a key component, they account for only 30% of the factors that influence our health outcomes. The remaining 70% is determined by broader social determinants of health, which include education, socioeconomic status, access to clean water, safe housing, law and order, access to information and digital connectivity, and the environment. For example, access to education improves health literacy and can lead to better health behaviors, while a safer environment helps reduce stress, injuries, and improves mental health. Improving health outcomes requires collaboration across all sectors of government. Only by integrating efforts across all sectors we can address the cause of poor health and build a more resilient and prosperous nation. Mr. Speaker, none of the achievements we celebrate today could have been realized without the steadfast support of our partners. As I have already mentioned, our church partners, Mr. Speaker, are indispensable to Papua New Guinea's health system. They deliver nearly half of all our rural health services in the country and train most of our health workforce and serve our people with dedication and faith. We thank the Church Health Services for this important support. Mr. Speaker, the consistent and timely release of funding for church health services and for health sector more broadly must be treated as a national priority. When funds are delayed, frontline services are disrupted, and it is our people who bear the burden. We owe it to our communities to make sure that those who serve our frontline line of care are fully supported, adequately resourced, and empowered to continue their vital work. I thank the Mara Barroso government for the release of all appropriations for church health services in 2025. And we look forward to the full release of all the fundings again in 2026. It is therefore fitting, Mr. Speaker, that for the first time I present to this Honourable House the annual management report of the Christian Health Services and the Catholic Church Health Services since independence, alongside the National Department of Health annual management report to this House today. These reports demonstrate in clear and practical terms the impact of our church partners, delivering consistent, high-quality care to our people in some of our most remote and challenging parts of our nation, often with minimal resources but unwavering commitment. Development partners including Australia, New Zealand, Japan, China, the USA, Asian Development Bank, the Sanders Foundation, the World Bank, WHO, UNICEF, UNAIDS, Global Fund, Gavi have all supported our work across every part of the system. Local and international non-government organizations such as St. John Ambulance, Mission Aviation Fellowship, Mary Stopes PNG, World Vision, Rotarians Against Malaria, Fred Ollos Foundation, Hope Worldwide, Child Fund, Medicine Sans Frontiers, Youth with a Mission, Bennett Institute and Samaritan Aviation, and many, many others who work with us every day to help provide services, including in remote areas. We thank them very much. I sincerely thank all of these partners for working with us, sharing their expertise, resources, and dedication, and for their unwavering commitment to the health and well-being of our people. In conclusion, Mr. Speaker, by the centenary of 2075, that's 100 years of our country, we envision Papua New Guinea where life expectancy will exceed 75 years. Maternal mortality falls below 50 per 100,000 live births. And infectious diseases like tuberculosis, malaria, HIV, and HPV are eliminated. Non-communicable diseases will be halved, and every citizen will have access to care within 1 hour of the community. Mr. Speaker, our Prime Minister in his inaugural address to Parliament on the 9th of August 2022, as the 10th Prime Minister of our country, reminded this nation of an important commitment. He said that our citizens have a fundamental right to have access to healthcare facility within 1 hour in every mode of transportation. Mr. Speaker, this is not merely a political statement. It is a clear policy statement of intent that connects national policy to tangible implementation. It reflects the fundamental belief that every Papua New Guinean has the right to access quality and affordable healthcare within reasonable reach, regardless of where they live. Mr. Speaker, as a health sector, we are encouraged by the progress being made and are confident that we are on the right path towards achieving this vision. Through continued investment in health infrastructure, expansion of the workforce, strengthening of medical supply chains or systems, and improved public health programs, we are steadily building a health system that will bring services closer to our people and ensure that no Papua New Guinean is left behind. The government has demonstrated its commitment to this vision through sustained investment in the health sector budget. In 2024, a 2.181 billion kina was allocated to health, representing 9.5% of the national budget. This increased to 2.77 billion kina in 2025, or 9.7%. National budget. In 2026, the Mara Barroso government further strengthened this commitment by allocating 3.21 billion kina to a health sector, representing 10.39% of the national budget, a substantial increase of 15.8% from the 2025 appropriation. I also compliment the Mara Barroso government of the Connect PNG program. Most of our districts now have the resources to drive their own development and are empowered to use those resources to improve health in their communities. Mr. Speaker, these investments, together with policies, reforms and programs I have outlined today, represent a significant step towards achieving universal health coverage by 2030 and beyond. With strong political leadership, clear policy direction, effective sector leadership, and continued partnerships with our provinces, churches, development partners and communities, I am confident that we will continue to strengthen our health system and deliver better services for our people. Mr. Speaker, investing in health is one of the greatest investments we can make for our future country, for our future generation in our country. A healthy population is the foundation of a productive, prosperous and resilient PNG. My fellow members, you say the responsibility for ensuring your people receive the services that they need. Your leadership and commitment can transform lives, and we in the health sector will stand with you and support you. As we say, health is everyone's business. Therefore, I ask you all to work with me to make good health and well-being a reality for future generations of our country. Mr. Speaker and Honourable House, I thank everyone today for this dedication, and I present all these reports, as I said, to Parliament. Thank you, Mr. Speaker.
Leader of Government Business.
Mr. Speaker, I move that Parliament take note of the paper, of the statement, and I wish to make a statement or to debate on this very important statement by our good health minister. And I commend him for the work he's done in taking care of the health department and the tremendous work that he has done in terms of enforcing the reforms that are now starting to bear dividends back into the system. And just like every other system that we've taken care of in the term that we've come into government since 2019, and there are a lot more work to be done, but at this instance I want to appreciate our good health minister. Mr. Speaker and the Honourable House, if you look through back into the budget, and as highlighted by our good minister, in 2014 we allocated 2.18 billion into the health sector. And as our good minister highlighted, and as we all know, health is all our business. Prevention is better than curing, but in this instance, when we do not take heed of our own health, we sort to our facilities and our medical infrastructures. This government has now put more emphasis into health. We've increased our budget by 10%, as highlighted by our good minister, from 2.8 billion to now 3.21 billion allocated for 2026. The continuous partnership with all our development partners is quite evident right across our good country. Many of our level 4, level 5, or actually level 3, level 4 hospitals in the districts are now being achieved, in particular with our good partner of ADB. And I want to appreciate this government. Me talk thank you through long. Look save long all people Blomilo Bougainville. For the first time, we now have a level 3, level 4 hospital, particularly placed in the northwest of Bougainville, where it was neglected for a very long time. And today, I can proudly say that the Marape Rosa government, as a government, being inclusive, representing all of us, both sides of the House, that we are addressing some of the most neglected districts we've had in the past in terms of our health services. So on behalf of my people of Bougainville, I want to say deep appreciation to this government and to our ADB partners. Not only are we delivering in northwest of Bougainville, there is also a level 4 hospital, as highlighted by our good minister, in South Bougainville. South Bougainville is the border of our country in the north-south of our geography. It is only about a 2-kilometer distance from Solomon Islands. It is around 20 minutes that you would get to Shortland, which is an island of Solomons. And so when the level 4 hospital is built, I can safely say that it will not only serve the people of South Bougainville and the greater Bougainville, but it will certainly serve our neighbors, our traditional partners, the people of Solomon that have also helped us during the civil unrest when we were looking for medical assistance, food rations, that they came to our aid. And I want to say that this is not only an infrastructure that will serve our people, but our greater partner on a greater relationship with our people of Solomons. Assistant Speaker, we've seen that in development, we've been very good in developing and in building infrastructure, but the biggest challenge we have is managing our infrastructures. And I want to commend the church services. I also want to say thank you to the health service workers around the country. I do not say that you do anything less, but I just want to give this special time to amplify what the churches are doing more than the public service. The churches are truly filling in the gaps where we as government are not able to, but that is where the partnership comes in. So I want to say thank you to the churches. Today the churches are delivering right across our country, and it is making a significant impact in the way care is being delivered with our health workers. Speaker, as highlighted in the statement, there are reforms happening within the system. The public health policy, I would like to say that the good minister has led in front with the reforms of the Public Health Act, the Mental Health Act, and the Health Practitioners Framework. This is a reset in its entirety in helping the system to be more effective, efficient, and addressing the whole of health system that today we're working towards enhancing to better serve our people. With that short debate, Mr. Speaker, I commend the good minister for the work he continues to do for our country in the health sector, which is very challenging, but he has certainly taken up with vigor, and he certainly continues to now drive the reforms that this country needs in our health sector. Thank you, Mr. Speaker.
Remember Abang?
Thank you, Mr. Speaker. I just wish to debate only on a few issues because, as you saw, I just came in, so I haven't had time to listen to the Minister. But firstly, commendations to the Minister for the report and to his department for preparing the 2024 annual report, which is a very good achievement by the department. I think there are many departments that are not up to date with the annual report, so I commend the Minister and his Secretary and his executive team for informing the Honourable House with up-to-date report on the important sector, health sector. I note from the beginning of the Minister's statements that he has highlighted some of the important achievements in particularly the key health indicators in the country over the last 50 years. And I have to agree that a lot of achievements in the health sector have happened over the last 50 years. Many people always criticize the health system and the health sector, the departmental heads, but in actual fact, when you look at the key health indicators, particularly, for example, the maternal mortality rate, it really has significantly dropped from close to 500 to just 100 per 100,000 deliveries. And that's a very big achievement, thanks to everyone, including the churches that the leader of government business has acknowledged, the private sector included, but very importantly is the system that the country adopted since the current health system has been in place, from 8 posts to sub-health centers to health centers to district hospitals to provincial hospitals to now specialist hospitals. That's the structure of the health system, and it has served us very well. Our biggest challenge, Mr. Speaker, is twofold. One is the Parliament's inability to properly resource the health sector. That's the biggest challenge that every government that I have served under have not seriously given the required amount of funding that this important sector deserves. And you can talk about this government funding this sector the highest ever, but when you compare it to the actual value and the warranting and the disbursement on time, it doesn't come closer, even this government. I want to highlight a report that came in this morning from the National, and the heading is Health Report Reveals Chronic Underfunding. That's in today's National. And this is the absolute truth about many governments over the years not giving sufficient resources to this important sector. While the innovations and technologies and the medications and the skill sets have improved in the health sector, including the availability of drugs, immunizations, anti-TB drugs, leprosy, etc., etc., those high standards of health care themselves are contributing to the improvements in our national health indicators. But in actual fact, in terms of government performance, it really, as I said, in two areas, and one of them is funding, as highlighted by this report yesterday. Unfortunately, it gives this actual report, which was presented to the health conference, highlights the despair and the seriousness of how low health sector has been funded over the years. And this report highlights 2024-25 funding, and it concludes, and I read, to give a regional perspective, the report pointed out that PNG spends 23 kina per capita compared to, for example, Thailand, which spends 3,000 kina per capita. Now, 23 kina per capita, 3,000 per capita is a very, very big difference. And I've always been complaining, for example, in the medical supplies sector, and this highlights the medical supply situation in the country, including my time as short time as health minister after the 2017 elections. We still were not able to provide the right amount of funds for just the medical supply subsector. I've been saying now that our population has already been documented in the recent census, then I strongly recommend that the minister, the treasurer, sit down all the time and really look at this special area, very serious area, because when we are sick, we need the medicine available all the time, rather than the doctor saying, get this prescription and go and buy it in the private pharmacy because we don't have it here. That's a question that that's the issue that is always facing our ordinary citizens. And so this has to stop one day. And through you, Speaker, the Minister who himself is very well aware of this issue, and when he provides a $400 to $500 million budget for medical supplies, in this report says it's always cut by 50%. Lives here. Pneumonia child arrives at the outpatient. That child needs penicillin, but when the nurse says, no got penicillin, and by die. So you cut the medical supply 50% submitted by the Secretary for Health. Why? You just allowing a child to die because they don't have medicine? Is that moral? Is that ethical? Is that acceptable? I said, no, it's not moral, it's not ethical, it's not acceptable. Leadership has to rise to the reality. Just a 25 kina per capita is spent on health between the time of this government compared to countries where they spend over 2,000 kina per capita. We have to rise up. We cannot just give a flowery statement like I used to do on the other side when I was on the other side. That has to stop. This is the time to come to the reality. I was a secretary at a time when we didn't have this type of budgets. I cried. I used to go to the Secretary for Treasury and Finance. That time they were Finance and Treasury together. One secretary was running. I used to go in, I will not leave your office until you give me this budget. That was what I used to do. But we had very small budgets. But we maintained the supplies while I was secretary. But now with big billions of kina per budget, Secretary for Health Our Minister for Health submits a 400 million for medical supplies, and you cut it deliberately. Treasury cut it. That mustn't be allowed, Prime Minister. All Pekinini, all Yumi, life here. You cannot go and get a spare part. So, $10, that's 40 kina per head must be World Health Standard. 40 kina per head for medical supplies. 12 billion MNAF, 500 million next year's budget, medical supplies. So many, many other sectors. Immunization. Minister reported a 95% coverage polio. And no special programs here. Our immunization coverage drops to the standard below 80%. That's why polio comes in. That's why other diseases, immunizable diseases have been coming prevalent. Polio, the classic example. When we drop to below the World Health Standard of 80% immunization coverage of our children, polio comes in. Now you're pressing yourself for 95%. No, that's because we have special immunization programs supported by our very good international partners. Immunization programs must receive the budget that they deserve because they protect the children. Like the drug budget that I'm arguing about. There are specific health interventions that must receive the level of funding they deserve. Medical supplies is the classic example. And in the immunization programs is one such example. They are highly cost-effective interventions, immunization. As a minister said, and then the leader of government business repeated it, prevention is better than cure. So there are specific areas when the budget comes. I am pleading to our government, led by our Prime Minister, to ensure that the real budget support is provided. And then the chronic issue is release the funds on time, yeah. You can release the funds for Connect PNG, doesn't have to be on time. But for health, it has to be on time. If you don't release the funds on time, medical supplies are not bought on time, people are turned away at death occurs. That's the argument that I want to pose today. The second point, and I haven't read the whole speech, but in the human resources area, which is also very, very critical, Minister has reported that there are 32,064 established positions in the country for health. 11,135 are not filled. I strongly recommend to the Minister, through you, Chairman, what we used to do. We would negotiate with the Department of Personnel Management to pre-create health positions. This year there are 50 graduates from the medical school for doctors. You go to DPM and you say, create 50 positions now, not when they come out. We used to do that. So every doctor that came out graduated, he would automatically fill in that position. We prepared a position number. So no qualified health personnel, whether you are a doctor, a technician, or a nurse, you were waiting for your position to be given. They were already pre-arranged. You have to go back to that structure, that system. DPM has to allow, Public Service Minister and Minister, Speaker, that has to be done. Because you are talking about health, our life. There is 11,000 positions I don't know how many of them are not funded. All positions in health must be funded. What are the priority areas that you are going to debate about that they will be funded? Health is #1 priority for this government. You always say it here, Prime Minister, you will announce it every public statement. Health is your government's priority. But why do you allow 11,000? Nearly half of the positions are not yet filled. And I believe this is because of lack of funding. This is because the structure that we used to manage before has been thrown out of the window, that positions are not created prior to the health secretary and the education secretary, higher education secretary must speak to each other. This is when we move the health sector training from health sector to higher education, lack of communication. And so the higher education is training nurses and doctors. They are not talking to the system that is going to employ them, and therefore they are not preparing and creating. So these are the issues, Assistant Speaker, that I believe are very, very important, and I want to commend the Minister as well as the Prime Minister for bringing the bill on establishing the University of the Medical School and Health Sciences, and for all of us supporting it, because I believe that is the way to go. I also am of the strong opinion that every university in this country, whether it's Goroka or Divine Word or PAU or now IBS, they also must have health programs in their university programs. And therefore, in my debate the other day, Assistant Speaker, I was saying that we should have a legislation. And I suggested an organic law level legislation for universities. So Parliament doesn't have to come and pass one law for every university that comes. The Secretary and for higher education, like you approve for schools, the Provincial Education Board approves which school to be recognized, which technical school in Abao should be recognized, so that they can move into the funding program. That's all you have to do, even at the university level too, that this university has been recognized and Minister announces it. We don't have to create a law. And in my argument, I was going to say, and now that I have the opportunity, I think every university should achieve a minimum standard of curriculum and academic programs, so that we say you are a full-blown university if you meet these academic requirements. And for example, in my argument today, debate today, each university must have a medical school. They must have a nursing program. They must have a physiotherapy program. All those requirements, or teachers program. So before we used to go for Goroka Teachers College, etc., etc. Now I'm advised by Goroka that they would be ready to establish a medical school. And somebody is stopping it. Why is somebody stopping it? Don't stop it. When I became, it shouldn't have to be for the minister if you want to be recognized as a university. If you just focus on the teachers, will stay as a college. That's my argument. If you want to university, meet the requirements of a true, fully fledged university by giving this degree, that degree, every degree, the minimum number of degrees that universities should be allowed and to be recognized as universities. So, Assistant Speaker, I commend the Minister for this report, but I know that there's a lot to do in the health sector. I strongly urge the government support. I think the resource allocation budget figures heavy, but actual funding doesn't go. And this is the sector that must never be allowed to undergo this type of treatment again. Thank you, Assistant Speaker.
Member for Wow.
Thank you, Assistant Speaker. Look, so people blow away. Assistant Speaker, me like commend him, the good Minister of Health. He's been really hardworking, and he came up presented this report. Is really good. So I want to congratulate him for this report. Couple of points, me like mentioned, I think related to rural health facility, health. Number one, the report said that about 7,000 positions have been created and vacancies will be filled, and that is particularly for rural health, rural housing, all 8 posts with me. And as a speaker, this is very good, and I truly appreciate this. Because as me rural place, through health services in Richmond. Medicine, bigla something, but narabla something in Walkman. All health workers, they need to be present at the rural areas, and that position, that increase of position vacancy being filled is really good. We have about over 6,000 council wards in this country. Suppose you meet him all the requirement, create him council ward. Every council ward should have a health worker or primary health care worker. Now, this law position will create him one ward. Time will create him ward. The ward you create him time, you must create him one position primary health care worker too. Now, I think this is a step to the right direction. We must have health workers in every council ward in this country. There is a reason why we create council wards, because population will grow. Now, government service all need him, so all create him council wards. So every council ward in this country must have health worker. And I would like to commend the health minister that for the recruitment of 7,000 workers, and hopefully all the rural council wards in this country will be filled by those health workers. That's point number one. Point number two is the incentive that the health department is giving to the doctors to move to the rural districts. And this is a very good incentive, and I would like to commend the minister and the health department for that. Plenty of rural districts, and we lack doctors, and we have to travel all the way to the towns and cities to have access to doctors. Now, look, small doctors come to rural districts, and hard straight. So this is a very strategic move by the health minister and health department to create that incentive for the rural districts to receive the health, to receive doctors. And Minister, I would like to commend you on that. Point number three, Blomi, I'm not really on infrastructure, but it's on keeping the healthy people healthy. We spend about 10% of our budget on health. This year, we'll be budgeting 10% of our budget on health. So we are spending about 10% of our budget on 10% of the population they are sick. But our focus also should be on keeping the healthy people healthy. And that is education and awareness. Some people sick, now you may walk pain him. Emino sick, or some kind sick where you may yet cause him. Lifestyle diseases. Now you need more sophisticated, more machine, or expensive more machine, or detective more sick. We're sick, and you may yet suppose if we have do good awareness, if there is good education, we could have prevented those diseases, those sicks, and we won't be going to those, needing those instruments or sophisticated device or medicine, even spending millions of kina on it. So, health minister, one area for the health department is not only on infrastructure and medicine and all this, but we must also focus on awareness and education about health too. And that starts at the community level, at the primary health level. And I would like to commend you, when you create the position for health workers at the community level, they could focus on doing those awareness and stop those preventable diseases that from happening, like TB, diabetics, Those are the diseases can be stopped at the primary level, primary healthcare level. So, Minister, while you focus on medicine and infrastructure and all this, you could also focus on awareness, education, so keeping the healthy people healthy. And the other rising cost of health in this country is with regard to alcoholism. Now, it can be law and order related, but the effect, the cascading effect that it has on the health sector is really tremendous and bigly true. Result of alcohol. You may talk law and order, but you may not think the health too, the side effect of the health, the alcohol is having on the health. Now, people are facing plenty of woundings, wounding, killing, and causes of this is, if you look at it properly, it is result because all men drink beer. Papua New Guinea, true, good love, you may know how to drink beer. You may know how to drink beer. You may cause him low another problem, but the cascading effect of the health sector is very big. You may need law. Health Minister, you need to work with the police minister, and you guys need to work with the commerce minister, and you come up with something law regard to alcohol in this country. You may need to stopping passing law. It's like a drink spark, na fight, na cross, na. It has a big, in my district, it has a big impact. People like me talking with HCO Blomilo, calculating how much cost related to alcohol. It's about 70% of the cost of medical care related to alcoholism. So this is a big thing in this country. It's no longer an health, it's not also a law and order issue. Alcohol is also an health issue too. The impact of alcohol in this society. So these are my points. My good Minister, I hope you take note of this, and I would like to commend you for this report. Thank you, Assistant Speaker.
The Opposition Leader.
Thank you, Assistant Speaker.
Sorry, the Deputy Opposition Leader.
Thank you. Thank you, Assistant Speaker, for giving me the opportunity to join queue with the colleague members of Parliament in debating this statement by the good Minister for Health. And before I do, I want to also commend the Minister on this comprehensive statement and reports that he has tabled today. Mr. Speaker, obviously there's a lot of work involved in the health sector, and it's a very important service in government service delivery. Health and the need for health cannot be understated. But I also want to commend him particularly on the intervention of incentivizing rural, introducing the scheme of incentivizing rural doctors, giving them 100,000 allowance as an incentive to work in rural areas. I hope this can also be extended to not only doctors but community health workers and nurses as well, because this will then make the package a complete one. So I commend our good Minister in this regard, and perhaps it's a very good incentive, some of these interventions. Whether we can roll it out in the masses or not, it's only time will tell, but it's always important to start somewhere. And the good Minister has taken the initiative to start. I think the same is also true, Mr. Speaker, in the case of our education sector and with teachers. Many facilities where the DSIPs and PSIPs are invested into rural areas will find that teachers or health workers very quickly run back to the city and never go back. So this is because there is no either lack of services or lack of access or lack of incentives. So this is a very good intervention, and so the education sector really should look into something similar, if not in the hundreds of thousands, something close to this. So allow the teachers the opportunity and privilege to stay outside and work and focus on the future of our country and its education sector. The real reason, one of the other reasons that I rise this afternoon, my debate is very short. But, Mr. Speaker, I'm looking at the National Health Infrastructure Plan 2025 to 2035. That's a period from
today for another 10 years. And at page 57 onwards relates to the Central Province. Mr. Speaker, Assistant Speaker, the Central Province, in its opening sentence already, this report, I hope, is not set in stone, and there's room for adjustments, but the good minister can take note. There are 5 open electorates in Central Province, not 4. Because it reads, Central Province comprises of 4 open electorates. There's already a mistypo, I don't know, but Hiri Kairuku. There is no Hiri Kairuku in Central Province. There is a Hiri Koyari and there is a Kairuku separately. And there's a Bao, Guelala, and Rigo. Mr. Speaker, the data here relied upon also worries me insofar as regards the province. According to recent census, Central Province has apparently at the time, now this is debated heavily, but as a point of reference, there's 373,000 people, could be more or less. I say it's pushing towards for 400,000 region, if not 500,000. And in Hiri Koyari alone, it is said that there are about 106,000 people, 55,000 are male and 49,000 are female. In page 57 of the report, there's a table there. It says that there are 154,000 people in Kairuku Hiri. Mr. Speaker, please alert your people that the district has split and it's Hiri Koyari. And Hiri Koyari alone, we have 106,000 people, 110,000 to be on the safe side. The health data there, infrastructure data there is worrisome, but there are notes here that also concern me greatly. There's reference to the infrastructure in the province, but my particular interest is around the Central Province Health Level 5 hospital that's been dreamed about for quite a very long time. It says, if I may quote, parts of Central Province are quite close to POM-Gen, and with no provincial hospital, patients will be using POM General Hospital. We are trying to avoid coming to POM General Hospital, Mr. Speaker. Our people want to use their own hospital. We should stop using the POM-Gen Level 6 Specialist Hospital. This is, I've said this many times and I will not stop, we keep going. Further quote, this province also has very low bed numbers. It should be a priority to build a new Bautama Provincial Hospital. I agree. I also agree that the bed, however, with the current estimated population, it need only be 180 beds. I disagree completely. The provincial hospital must be resurrected and there must be 400 beds as initially designed and as initially planned. 457 beds, the ratio is for 457 beds over a period over 400,000 people. You do the math, it works out to be 1,000 persons, so 2,000 people to one bed. It's already congested even if we were to provide one. So it's highly imperative that we have one level 5 hospital in Central Province, and the land has been allocated at Bautama. There's about 52 hectares of land that has been secured with the title to Bautama for the new provincial hospital in Hiri Koyari district. That was launched 5 years ago, and I think the good Prime Minister will attest to that and confirm. I think it's a very important intervention of the government and of the Pangu-led government, and it should not deviate from it. If there was anything I would agree and support this government on, this one should be one. You know, Mr. Speaker, I say this with great caution because this debate also works against some of the aspirations we want to do in the district. Every district should have a district hospital. Without the district hospital, one can only choose either one or the other. I'm prayerful for two. The provincial hospital must go ahead at Bautama. Your land is available, and you should continue. The district hospital, when priorities are set in this province, it seems the PHA has only highlighted Rigo district, Kairuku district, Koilala district, Abau district. We sort of missed out Hirikwari district and coupled it with the province's vision for a hospital. The Hirikwari district is also accommodates, in fact, accommodates more. Its population is quite dense, into the 110,000 region. I think a district hospital is well overdue. So I understand there's an ADB program that's that's providing infrastructure interventions, as they have done in Pomio quite nicely, and Gazelle and other nice districts. I think Hirikwari deserves one too, and should be on your national plan. So if there were any addendums to this National Health Infrastructure Plan 2025 to 2035, these are my little interventions and my contribution to this debate. And I commend the good health minister. You've done fantastically well ever since taking up your post. I'm sure we can make I'm hopeful that we can, the good minister can make adjustments in this regard. Thank you, Tomas. Now God can bless you, me, and commend the statement and the reports in this regard.
The Honourable Deputy Prime Minister.
Thank you, Mr. Assistant Speaker. I'd like to take this opportunity to commend the good health minister and also join in the debate with a short debate. First of all, commendations to the health minister. It's good to see your reports coming in and the improvements that are being done to the health system in our country. And no better person that can do it is none other than an appropriate person like yourself, who has been the CEO of one of the best performing hospitals in Papua New Guinea, in Vanimo, in your time in the public service. So commendations to you, and you bring that shining example to the national scene on the floor of Parliament in your capacity as a health minister. So I'd like to join in saying thank you, and also your hard work and putting the reports in. Whilst we, Mr. Assistant Speaker, whilst we debate and we all admit that there's huge challenges. There are huge challenges, not only in the health sector, in our education sector, in all other sectors in a country as diverse as Papua New Guinea. It is not easy with the envelope of availability of funds to try to fix everything, Mr. Assistant Speaker. The availability of funds to fix everything is important, from law and order, from teachers and education infrastructure, to higher education, to a law and justice system, and, Mr. Assistant Speaker, to our roads connectivity, and also a very important one, an important challenge is the health system itself. But sitting here and listening to the report and seeing the improvements that have been done, I'd like to commend government, because whilst we debate, and according to the figures here, the government, and I quote, the government has demonstrated commitment to this vision through sustained investment in the health sector. In 2024, 1.81 billion was allocated to health, representing 9.5%. 2.77 billion in 2025, or a 9.7% increase of the national budget. 3.21 billion, representing 10.39% of the national budget. A substantial increase, Mr. Assistant Speaker, of 15.8% from the 2025 appropriation. I'd like to compliment government on this too, because despite the shortages, we have seen the importance of the health sector, a very important sector, and we have continued to increase budget. And yes, I agree, it should be more. I agree it should be more. But we need to grow the budget to ensure that every aspect is looked at. The health sector, the teaching sector, the education sector, the law and order sector, the infrastructure sector, all this with a country like Papua New Guinea that continues to grow, with a population in 1975, Mr. Assistant Speaker, of 2.8 million people in 1975, with the growth of population to today of close to 11 million people, 10 to 11 million people, Mr. Assistant Speaker, the growth itself is outstripping our demands to be able to fix all these problems adequately and with sufficient funding. But yes, despite these challenges, government has stepped up and government is doing its best. So I'd like to commend the Health Minister on this. When you look at it, Mr. Speaker, 10 years ago, some of the most fundamental issues that affect our population, it gives me peace to know that now at POMGEN and Lay, we have kidney transplant and dialysis facilities that can be able to assist our people. We also have heart patients that are now being treated in our facilities here. 10 years ago, it was unheard of. Everyone had to go overseas for it, who could afford it. People who could afford it, and a lot of people just couldn't afford it, Mr. Assistant Speaker. Today, you have about 2,000 heart patients treated at an average of 150,000 kina per patient, contributing to about 300 million kina that remains back in the country. And these patients couldn't afford the 150,000 kina to go overseas for treatment. Now these patients are able to do it here in their own country with that dignity and being able to pay a small amount of 10,000 kina. That is able to assist a lot of our people, a lot of our citizens, Mr. Assistant Speaker. While we sit here today, we look at the funding we have put into hospitals like in Enga. Because before, Mr. Assistant Speaker, all patients had to travel to Hagen, all patients had to travel to Ley to get treated. Mr. Speaker, now with the brand new Enga hospital, patients now will be able to be dealt with in Enga and the surrounding areas. The new hospital that was built in Isipik, Mr. Speaker, commendations for the people of Isipik and also in West Isipik can be able to access good facilities there. The new Enga hospital, courtesy of our development partners, the Australian government, I give a big thank you to them too, for the new Enga hospital that is being built, has been built in Engau and now continues to support the people from the northern Momase region and up the highlands. A lot of people are getting treated at these facilities. Mr. Speaker, when the Engau Hospital, Mr. Assistant Speaker, when the Engau Hospital was open, I shed a few tears, Mr. Assistant Speaker, because I felt for our people in Ley, my relatives who could not afford to go to other places for preferential treatment. At least my relatives, my people could be able to now get treated in a hospital close to their doorstep. And with that, I'd like to thank both the PNG government and especially the Australian government for that contribution to the health sector in Papua New Guinea. I'd also like to take this time, Mr. Assistant Speaker, to say thank you to all development partners, plus our church health partners. Whereas government sometimes falls short, our church partners, Mr. Assistant Speaker, are always there, stepping in, assisting in a lot of our areas. Those church partners we continue to support, and we say thank you to them also, Mr. Assistant Speaker. I'd also like to say thank you to the hard-working medical staff, the doctors, the nurses, especially in remote Marawaka, in remote Meniamia, in remote Goilala, in remote Karamoy. Those hard-working church and medical workers, Miletok big thank you lo yupla olgeda. Yupla stop na holian lo government, and we owe you a big thank you from government. We pledge as government to support this, Mr. Assistant Speaker, that the health sector remains a fundamental and important sector that needs to be supported from both sides of the House, jointly, unitedly. We need to ensure that our education sector, jointly, unitedly, from both sides of the House, where we can, be able to support both these sectors and put the appropriate budget in place where we can afford to. Because, as Sir Puka pointed out, health is a priority for our people. Education is a priority for our people. Law and order is a priority for our people. And as a responsible government, we should all, on both sides of the House, support any action taken to alleviate, Mr. Assistant Speaker, any issues in these sectors and give them the priorities they deserve. Yes, Mr. Assistant Speakers, there are still challenges. There are still challenges. And after government has come and gone, in the next 10 years, there will still be challenges, Mr. Assistant Speaker. The challenges will not go away. But it is our duty to ensure that those challenges in our time are addressed. There will be more challenges because in 5 to 10 years' time, our population, Mr. Assistant Speaker, will have grown. Will have grown and will need more hospitals. As the Honourable Keith Idahu pointed out, Central Hospital needs a hospital. Totally agree. We need to put a hospital for the Central people. And government will support you in that advent and to ensure that the people of Central have a hospital that is rightfully theirs. Totally support that, Mr. Assistant Speaker. And having said that, every district should have a district hospital, Mr. Assistant Speaker. Every district. Every province should have a fully functioning hospital, Mr. Assistant Speaker. That should be a priority. But it all comes down to the money fundamentals. So I can assure Parliament, Mr. Assistant Speaker, that government will continue to support this vital sector to ensure that we make appropriate funding and every year continue to tick off the boxes. So ensure that each district has a district hospital, that each province has a provincial functioning hospital, and that we continue to grow and invest in the health sector, Mr. Assistant Speaker, to ensure that we have sufficient staff, that we have sufficient medical supplies, that we have sufficient necessary technical staff to make these hospitals and health sector function. Mr. Speaker, it is no easy fix. It is no easy fix. It is a challenge, but I would like to assure this House and Papua New Guinea that we'll continue to face these challenges and put the appropriate funding, appropriate legislation and the appropriate support to ensure that we continue to address this vital thing in the health sector. For vaccine funding, especially in the cancer facilities, for our women and children, Mr. Assistant Speaker, hearing this announcement in the report and knowing that we are going to help ensure our young women, our young girls are vaccinated against this scourge of cancer. Every one of us sitting in this room, Mr. Assistant Speaker, has lost a relative, a sibling, someone we know from the scourge of cancer. It is not an easy thing to live with. I currently have a sister with cancer, battling it at the moment. I wish this had come 10 years ago. I wish this had come 10 years ago. She would not be battling cancer. But Mr. Assistant Speaker, the future is there. We still have young women, young girls that are there. And it is our duty to ensure that they are protected from the scourge of cancer. We have the power to do so. And I'd like to commend the Health Minister and government again for putting money where its mouth is to ensure that our women and young girls are vaccinated so they do not have to go through the pain and hardship of cancer facing it. Mr. Assistant Speaker, once again, health remains a challenge. The report has said there's 32,064 established positions in the health sector, 11,135 remain unfilled, highlighting the urgent need for stronger recruitment, Mr. Assistant Speaker. But I'm also gratified to see that the government has demonstrated its commitment through the Health Minister by approving an increase of 233 million for personal emoluments in 2025, Mr. Assistant Speaker. And I am pleased to report, as seen here and quoted in the report, that the recruitment for 7,000 of these vacancies of healthcare workers, particularly for rural and undeserved areas, underserved areas, my apologies, underserved areas, English is underway. So I would like to commend this and re-echo what the good member for Wow Warrior said, is that a lot of our rural areas need to have a medical health post, and a health worker sitting in the village attending to preventive diseases and minor ailments that we all need to have as a priority. Mr. Assistant Speaker, this continues to be a challenge, but as I pointed out earlier, government stands fast and united. I am certain I speak for the opposition also, to address the underlying factors of health to ensure that our population, Mr. Assistant Speaker, receives the best treatment possible. We'll continue to work, we'll continue to support the health sector in budget appropriation, we'll continue to reviewing laws to ensure, Mr. Assistant Speaker, that our people get the best that they should get within our lifetime. And we hope that in future, people will continue this good work. With that, Mr. Assistant Speaker, I would like to commend this report to Parliament as outlined by a good health minister and say thank you again for the hard-working health staff that we continue to see them fighting on the front line for our people. Mr. Assistant Speaker, whilst government puts money, changes laws, I would like to also encourage and advise our health staff, Mr. Assistant Speaker, that as always, good governance in our PHAs is important. Good governance in all our PHAs. It is not about how much money you receive. It is how much you make good use of that money. You can be given millions, but if you do not manage that millions well, then that millions is of no use to anyone, Mr. Assistant Speaker. Good management in every sector is essential, Mr. Assistant Speaker, to manage whatever little amount we get. Prudent, good management in every sector, Mr. Assistant Speaker, and especially in the health sector, that people who are entrusted with management of these funds make certain they run and administer these facilities and the management of those funds wisely. With that, Mr. Assistant Speaker, thank you, and I also would like to end my debate. Thank you.
The question is that the question be put. Those in favor say aye. Aye. Those against say no. I have it. Leader of Government Business.
Mr. Speaker, I move that the Parliament do not adjourn until tomorrow at 10 o'clock a.m.
The question is that the motion be agreed to. Those in favor say aye. Aye. Those against say no. I have it. Honourable members, I now adjourn the Parliament to tomorrow 10 o'clock a.m.